I want to stop taking my BP medication. Why would you want to do anything like that? What's going on, my guy? Doc, whenever I take the BP medication, I'm not able to perform. Perform, you get what I mean? Perform? Oh, right, I do get what you mean. But if you stop taking your BP medication, you are going to die. Hi, I'm Dr. Kelvin and you're welcome to my channel. I'm your wellness consultant, which means your health is my most important priority. And in this video, you guessed right, we are going to talk about one particular challenge that a lot of men have when it comes to hypertension medication. It is indeed one of the reasons why most men are not consistent on their medication, and also one of the reasons why a lot more men with hypertension die when compared to women with hypertension. So it's a very important topic, so you really ought to pay attention. Before we get started, if you have not subscribed to my channel, do subscribe to this channel, because here we learn a lot about how to stay alive for longer. You know what I'm saying? Alright, stick and stay, it's going to be worth your while. So, doctor, I'm hypertensive. Whenever I take my medication, I'm not able to perform. My erection is weak. It doesn't last as long as it used to. What can I do about that? Indeed, some hypertension medication have been known to cause erectile dysfunction in men with hypertension. This is a known fact. But do you know what else is a known fact? The treatment of such erectile dysfunction that is due to hypertension medication, we know how to deal with them. And so it is not a good enough reason for you to not take your hypertension medication, because it is the medication that is indeed keeping you alive. And so if I were you, I'll take that medication consistently. It's very important. Now, why then is it that if we know that there are medicines that cause erectile dysfunction, why do we still keep giving this medication to men with hypertension? And that's a very good question. Yes, very good question. The issue is that not all men with hypertension will have that reaction to the medication that we give. In other words, medication that causes erectile dysfunction in person A will not necessarily cause erectile dysfunction in person B. And so because of this fact, we have to give medication to you on a trial basis, for lack of a better word. And then depending on how your body responds to it, we know how to handle the treatment plan going forward. And so if there's a need to change the medication because it's causing too many side effects, we will change the medication. If there's a need to counter that medication with something else to reduce the side effects, we will do that. But looking at your profile, your risk profile, some medications may be better for you than for another person. And so if that medication that's better for you at that particular time also has a side effect of erectile dysfunction, we may not have any other choice than to still give that medication and then observe you for any such effects moving forward. Having said that, hypertension by itself will cause you to develop erectile dysfunction eventually. I mean, your body is very smart. There are two ways that hypertension will cause erectile dysfunction for you if you are hypertensive. The first is that if your BP is poorly controlled, your brain will prioritize your life over your erection. And so you will have weaker erection because your body wants to preserve itself. So you are not going to have that erection to go how many minutes before you ejaculate, because if your body should allow that to happen, you will die. You will stroke out, your blood pressure will go through the roof, and you will die on the job. You get it? Die on the job. We don't want that to happen. So your body will shut down your erection naturally. It's a normal reaction. The second thing is through atherosclerosis. Now, atherosclerosis and hypertension have a love-hate relationship. It's like a chicken and egg. We don't know which one comes first. Atherosclerosis basically is the hardening of your blood vessels due to deposition of cholesterol to form a plaque. Now, this plaque narrows the blood vessel lumen, the space for the blood to pass. And when that happens, there's a pressure buildup behind the plaque along the blood vessel. And this pressure buildup is what you record as hypertension. Now, if this atherosclerosis occurs in the vessels in your penis, obviously the blood flow into the penis will not be optimum. And you already know that it is blood going into the penis that causes you to have a strong erection. So if not enough blood is going there, your erection will be weak. And so hypertension mediated by atherosclerosis will cause erectile dysfunction eventually. This is why you need to get the BP treated, so that you don't precipitate or you don't increase your risk of atherosclerosis. Failing to do that means that you will develop the erectile dysfunction that you are trying to prevent. And so here is the fact. You have a disease that will cause erectile dysfunction eventually. And you have medication for the disease that may cause erectile dysfunction. Now, which of these two do you want to play with? The definite outcome or the probable outcome? I would definitely put my money on the probable outcome. I'd rather treat the hypertension, and should I develop erectile dysfunction, go back and get treatment for that as well. The treatment for the erectile dysfunction will just be changing the medication from one to another or adding something to counter the erectile dysfunction. We know how to do these things. So come to us and let's help improve the quality of your life as best as possible. Hypertension is a lifelong disease condition, but we can beat it together. Enjoy your stay here. Remember to subscribe to the channel as well. Very, very important, so that together we can achieve something great here. Have a fabulous time. Stay blessed. Signing out.